Good morning, everyone. This is Melanie with Angelo Kidney Connection, and I wanted to come on and talk a little bit about hospice and dialysis. There's been a lot of misconceptions, a lot of myths that surround hospice and dialysis care. A lot of people are afraid of hospice. They don't want to hear about hospice. Hospice killed my grandma. I've heard it all. I've heard it all. But let's talk about hospice. Hospice are for people who are facing a life altering diagnosis that is certified by a physician um, to last 6 months. And here's just a quick example. I've been diagnosed with cancer, and the doctor says I have 6 months to live. He's certifying that you have a critical end of life illness and you have 6 months to live. And nobody knows, right? Nobody knows. You can live weeks, months, years, nobody knows. That gives hospice the time and the ability, according to Medicare, to come in and help you. Not only do they help with your medical, they help with your day to day, they have volunteers, and they have spiritual guidance. And I don't know specifics about that, but I do know that they have pastoral care for people who want to pray, who want to talk. And that's one of the big differences between home health and hospice. Home health, you'll get care. It may not be day to day. You'll get a nurse, you'll get an aide. But hospice goes deeper than that. People with end of life diagnoses, and there's a whole list of them that qualify you for hospice. Some are very painful. Some are very painful. And I don't know about you, but doctors out there are not prescribing the narcotics and the pain relief, the pain medications that they used to. Hospice can come in and help you control your pain. Now, what does this have to do with dialysis? Well, dialysis qualifies for end of life diagnosis because without dialysis, you cannot survive. So, if you're on dialysis and you have another diagnosis, let's say you're on dialysis but you have heart failure or respiratory failure, or maybe you have cancer and you're on dialysis, you can keep doing dialysis and get hospice care. So it's like you get both. You get the best of both worlds. You're getting to keep doing your dialysis and you're going to get pain management. You're going to get nurses in your home. You're going to get aides. You're going to get counseling. You're going to get everything. And the dialysis center will work with the hospice. Now, what happens after 6 months? You either get off hospice because you're doing better, or the doctor will recertify you and get you another 6 months of hospice. And of course, there's lots of guidelines. There's lots, you have to qualify, and I'm not getting into that. I'm just talking about it's available. Hospice is available to you. Now, what happens if you only have what we call end-stage renal disease diagnosis? Let's say dialysis is the only thing you have and you want to go on hospice. You will have to stop dialysis because Medicare will not pay for both. You have to do one or the other if dialysis is all you have. A lot of people on dialysis have heart failure. A lot of people on dialysis have respiratory failure or lung problems. And there's a whole list of diagnoses that qualify you for hospice. So if you're ready to stop dialysis, please go on hospice. They will walk you through the process and what it looks like. And if you have pain, they will manage your pain. They will have people there for you. I would never want to stop dialysis and do it alone, ever, ever. What if you go on hospice because you have a critical illness and you stop dialysis? And let's say after 2 or 3 weeks, you want to get back on dialysis. Can you do that? Absolutely. We've had patients do that. They think, I'm ready to stop dialysis, I'm going on hospice. And after a couple of weeks, they're not ready. They're not ready. So they want to come back. And I always tell people, you can always come back. You're never locked in, ever, ever. Come back. Let's get you back on dialysis. Keep doing hospice. It's fine. I think hospice has there's so many myths. And I think we're gonna do a podcast about hospice because there's so much false information out there. And like I said earlier, a lot of people think if I go on hospice, they're gonna kill me, or hospice killed my grandma, or no. Hospice helps you through the process. They're there to help with pain management. They're there to help you with the day to day. They're there to hold your hand. They're there to help you. And we've had people on hospice for years. The doctor says this patient has this diagnosis, right? And they're certifying for 6 months. Patient's still alive, still coming for dialysis. They do another 6 months. Patient doing well. I mean, at some point, the patient will probably get off hospice because obviously they're doing well. So please consider hospice. Ask questions, talk to them. There's so many hospices out there that do a wonderful job. And if you don't want to stop dialysis, don't stop dialysis. You have that choice. If you stop dialysis, you can always come back. You're never locked in, ever. You're never locked in. So if you have any questions about dialysis and hospice, give us a call. We'll be happy to sit down and talk to you. If you are looking for a hospice, we can get you a list of them. So y'all have a great day, and talk to you soon.